what got you interested in what you do as a profession and
Sure, I'll be happy to.
to inform the students?
Okay, absolutely. Well, originally I was studying engineering at George Mason University, and I got out of that because I loved engineering and I loved computers and IT, but I just hated calculus. You'd be like 3 credits shy of a math major to pursue the engineering route. So my mom's a chiropractor also, so I said, you know what? I just made a big major change, became a biology major, and just got into it. And I really, really enjoy how I got into the profession.
Should we go ahead and start? Sorry.
Awesome. Well, good morning, everybody. My name is Dr. Hatam. I practice in Alexandria, Virginia, in the Northern Virginia area, and today you're going to learn everything. I mean, you're going to learn a lot of anatomy, you're going to learn a lot of pathology, and you're going to learn a lot of prevention of back pain. So, thank you for having me. Thank you for having me here. This is what we're going to be discussing today. In today's presentation, I'm going to be discussing neck and back pain. I'm also going to be discussing all overall basic spinal anatomy and the most common spinal pathologies that occur. I will discuss the topic of text neck and disc-related issues. I will also discuss simple tips to avoid serious back injuries, and I'll discuss why it's important not to avoid symptoms. Just a quick HIPAA note. Patient privacy. I will be sharing some x-rays and MRI images from my own patients. Names have been changed to ensure privacy, however, permission has been obtained from these patients to use these images. All right, basic spinal anatomy. So, what is our central nervous system? Our central nervous system is simply our brain and our spinal cord. The spinal cord is a continuation of the brain. So everything in our body is controlled by our central nervous system. Every nook and cranny. The bones right here are not your spinal cord. This is just simply a vertebral column. This little line you see right here, that's the spinal cord. The vertebral column is sectioned off into 4 categories. You have your cervical, which is the 7 bones of your neck. Your thoracic, which are your 12 bones of your middle back. Your lumbar, which are your 5 bones of your lower back. And the sacrococcygeal area. So, what is a disc? A disc is simply there to separate our vertebrae from each other. So, our disc has 2 areas. You have your inner nucleus pulposus right here, and your annulus fibrosus area right there. So, if any of you have ever heard the word like an annular tear, it usually accompanies a disc herniation. Annular tear is when we have a fissure right here, and that can be a very, very painful condition. So, what is the purpose of a disc? A disc separates the vertebrae from each other. It also protects the spinal nerves. So it's kind of like, imagine driving a car without shock absorber. So if your vertebral column didn't have discs, that's how your body would feel. Now, what kind of disc problems can occur? Normally, this is what a normal disc should look like on an MRI or on an X-ray. The first usually sign of disc problem is called degenerative disc disease. Degenerative disc disease is a fancy word for arthritis, basically, in the disc, not in the bone. Next, we have a bulging disc. A bulge is kind of like where imagine like a jelly donut and where some of the jelly is squirting out just partially. Now, versus a herniation is when it's more than 75% out of its socket. So, after that, we also have a thinning disc. A thinning disc simply means on an X-ray or MRI, it's basically you see collapse of the disc area right there. Now, the worst one, the disc degeneration with osteophyte formation. An osteophyte is simply, basically, a fancy word for arthritis. So in this case, you have not only arthritis in the disc, but you also have arthritis on the bone. And that will definitely lead to a herniated disc. So what are the symptoms of disc problems? You might not have any symptoms at all. You might not even know you have a disc problem at first. In order to feel the symptoms of a disc-related injury, there usually has to be stenosis. Stenosis, as you can see here, these are called foramen. These are where the spinal nerves go out of. When there's stenosis, it simply means that hole where the nerve lives is closing in, and that's when you start to feel the neurological aspect of a herniated disc, a bulging disc, or any kind of disc pathology. So, how do you know you have a disc problem? When it starts to get neurological. In the neck, symptoms of disc-related disorder can include neck pain, numbness, and tingling of the fingers, and weakening of the upper extremity muscles. In the middle back, symptoms of a disc-related disorder can include tingling around the rib cage. In the lower back, it can include sciatica and numbness in the feet. Now, the thoracic spine, the middle back, is the least common place you will get a disc issue because it's protected by the rib cage. However, it still can happen, so no one is kind of immune from that. Now, when you go to your doctor's office and they tap on your knees and your leg kicks, they're not testing your knees, they're actually testing your spine. So if your knee doesn't kick when they do your reflexes, that means you have a pinched nerve in your lower back. Now, what is the difference between disc and muscle pain? Disc-related symptoms are neurological. They will usually affect the extremity that bulge or herniation is on. So let's say you have a herniated disc on your right L5-S1, you're going to feel it on the right side. Your foot is going to be numb, and you're going to have a lot of burning pain in that area. Muscle pain is stationary pain that one can simply point to. Muscle pain and or spasms will not cause radicular symptoms. Now, how can we diagnose a disc problem? Simply subjectively, that means what the patient says, simply by asking the patient what her symptoms are. If they're having debilitating lower back pain and it's causing sciatica and burning in the right foot, you probably can narrow it down very easily. Objectively, through orthopedic examinations such as straight leg raise test, one can elicit the symptoms of sciatica. Now in the neck, let's say you have tingling in the fingers and you want to rule out this problem. If you pull on the patient's neck and it relieves the pain, it is a disc problem because you're actually taking pressure off the nerve root. Now if you pull on it and it makes it worse, then it's usually just a muscle issue. Radiologically, on X-ray, one can see signs of disc problems, but an X-ray only is a good starting point. An X-ray will not diagnose what kind of disc problems there are. The best tool to diagnose disc problems are magnetic resonance imaging, because a disc is made 80% out of water, therefore, and MRIs check for hydrogen protons. So that's why an MRI is the best tool to use to diagnose a disc issue. Now, how to prevent disc injuries? Simply drinking enough water per day is a good start. The disc is made primarily of water, and not drinking enough can lead to a condition called disc desiccation, which is a fancy word for dehydration. Therefore, if you're not drinking water, it's gonna come back and haunt you later on because it will cause your discs to shrivel up like a prune. So, the human body is 70% water, but the disc is 85% water. So if you don't drink water and you drink Diet Coke all day, eventually you're gonna ask for it. How do we prevent disc injuries? Simply, do not bend and twist at the same time, regardless of the weight of object. So if you see a quarter on the ground, don't bend and twist your body. Your body was not designed to do that. You either squat or just bend straight forward. So basically, to reiterate, bend with your knees and not your back. If you have to use your back, do not simultaneously twist. Wear a belt if you do deadlifts at the gym. This is very important, as a good number of disc patients see their backs destroyed by being macho. So don't bite off more than you can chew. Importance of a good diagnosis. So first case study here. In February of this year, I had a gentleman who hurt his neck doing repetitive squats at the gym. First incident happened in spring of 2014. He heard a pop in his neck and started feeling tingling in his right hand. He went to a neurosurgeon who told him it was no big deal, give him cortisone pills that got rid of the symptoms, but no imaging was ever performed. Told him it's fine to go back to squatting. 2 years later, he felt another pop while doing squats again. This time he went to a chiropractor who also told him imaging was not necessary. In fact, the guy told him x-rays will give him cancer. Got treated, and the symptoms resolved. Now, incident 3, the mother of all pops. So this year, in February, he heard such a loud pop in his neck that it put him on the floor. He was about to go back to the same chiropractor as years before, but he opted for a second opinion. And while I was talking to him, I asked him, well, let me see all your x-rays and MRIs. He said he never had any, so I knew this was going to be a problem. So, what do we see right here? Disc collapse on the x-ray, disc collapse right there. So 2 of his discs right here were obliterated on the x-ray. So we knew there was there was definitely a disc problem. So we went and did a cervical MRI. Now, this is the white matter. The front of this is the white matter. This is your spinal cord. This is the continuation of the brain right there. So it has three sections, the anterior white matter, and then the front white matter, and the posterior white matter right there. You can see on this MRI, you don't see the white right there? That means the discs have obliterated right through his ventral cord, his spinal cord. So he was constantly having pain, 8 out of 10, constantly. So the symptoms were horrible. He could barely support his neck, and analgesics such as ibuprofen or muscle relaxants, such as cyclobenzaprine, did not put a dent in the pain. He was referred to Dr. Donald Hope, neurosurgeon, for a surgical evaluation. And now this is his post-X-ray, after surgery. All his symptoms went away after getting this procedure done. They also put artificial discs right where his old discs were before, right there and right there. All symptoms resolved after surgery. The patient went from an 8 out of 10 to a 0 immediately after waking up from the operating table. His range of motion was fully restored, and he was extremely happy with the diagnosis and how everything went through. What lesson was learned from this situation? How imaging is vital to diagnose problems within the spine. Now, pain is the body's last resort to warn you of an impending problem. By popping pills with one of a chiropractor or physical therapist without actually imaging, we are simply guessing. Now, if this guy had, for example, if this patient had already had an X-ray just showing early signs of degenerative disc disease, we could have at least prevented. Someone could have told him, don't go doing squats anymore, you're going to end up like that, So it could have been, the surgery could have been easily prevented had any of his two previous providers did a simple X-ray to show the signs of early degenerative disc disease. Simply, if you go to your primary care physician and you tell him, hey doc, I have high cholesterol, and he looks at you and says, yeah, I think you do too, and here's some Lipitor. Wouldn't you want a blood test or some kind of objective measurable tool to get it done? Now, not all back pain is musculoskeletal. Musculoskeletal means just like it's relating to the muscle or the spine. While the majority of back pain is from a muscle, nerve, or disc issue, that is not always the case. Here's a few examples of more serious and scary back problems. I had a patient who would smoke 3 packs a day and had the worst diet in the world. I told him, don't you want to quit smoking? He said, no, he enjoys it. And cigarette smoking, the #1 cause of death from cigarette smoking is heart disease. So I took this X-ray, and you see this massive abdominal aortic aneurysm on him. I had to send him to the emergency room to get emergency surgery because he would have been dead in a few days. This was what was causing his lower back pain right there. Spinal neoplasms. So in terms of spinal cancers, there's 2 kinds. The first one is an osteoblastic cancer. So on an X-ray, when you see it's all lit up like this, you know it's not muscle causing your back pain. It is a cancer growing, and it's basically causing all your bones to light up like that. That's why we call them an osteoplastic lesion, plastic lesion. Now the opposite is an osteolytic lesion. Now osteolytic lesions, like you see right there, means opposite. So the bone is kind of eaten away from the cancer. Story number 2, October 2012, I had the pleasure of treating a 60-year-old man who hurt himself at the gym. He smoked for many years, but I quit for 2 decades. His symptoms all mimic that of a bulging disc. So I x-rayed his neck, and I saw the usual degenerative disc disease and everything. However, one thing struck me. One of his bones was not there. It went from 1, 3, 4, 5, 6. So I took a few more views, and I came to realize that this was a problem. So with this gentleman, unfortunately, we sent him to the emergency room. ER doctor called me and said that, yeah, your patient has stage 4 lung cancer, and unfortunately he passed away a year later. So good lesson here that, something more serious can be mimicking a musculoskeletal issue. No, don't take it lightly. Cauda-Equina syndrome. Now, our spinal cord ends right at L1. So after L1, you do not have any more spinal cord. It's now considered a cauda-equina. Why do we call it a cauda-equina? Because actually, on an X-ray, on an MRI, it will actually resemble a horse's tail like that. Now, cauda-equina syndrome is due to the damage of nerves around the horse's tail. Cauda-equina syndrome is a medical emergency that can lead to paralysis or even death. Number one reason you know if you have Hatam syndrome, if you have severe low back pain and just start peeing uncontrollably, go to the emergency room. That is not a joke. Text neck, like I saw a bunch of people outside coming in here. This is becoming an epidemic. Everyone walking around with their phones like this. And ever since 2007, when smartphones were invented, this is becoming more of a problem. And if you guys ever watch Dr. Oz on TV, he's the one who coined this term, text neck. So it's not just the kids now, everyone's pretty much doing it. So we do not have Wi-Fi, talk to each other, pretend it's 1995. While the social aspects of smartphones is bad enough, the health impacts are even worse. So this is a normal curve of our neck on an X-ray, and that's a military neck, or even a reverse lordosis, we call it. Basically, your neck is curved the other way. There are two ways this can happen. One, being in a rear-end collision. So they just did studies at Yale University on how this can happen. If you're hit even at 8.2 miles an hour, it will cause your neck to go out of whack. But the bigger culprit is this thing right here. As you can see, imagine all the damage it's doing to our bodies. How to prevent text neck? Always text at eye level. When you're outside, put the phones away. At work, make sure the computers are eye level. Bad posture also means bad health. Conclusion, to conclude everything I discussed right now. Don't ignore your pain. It could be a sign of a more serious condition. Don't blindly do treatment without a diagnosis. If you have spinal-related issues, avoid going to your primary care, as most of the time they will just drug you up with muscle relaxants and blindly send you to PT without a diagnosis. See a spinal professional, neurologist, chiropractor, orthopedic surgeon, who can actually order the imaging. I do my own x-rays in office. And always seek a second opinion if your doctor does not order imaging, especially if you aren't improving. And that's the important part. If you're not getting better with medication, because if you're having pain, for example, from one of the more serious lesions, ibuprofen is not going to put a dent in that pain. If your pain gets better with ibuprofen, then more than likely it's more of a musculoskeletal problem. But if your pain, if it doesn't put a dent in your pain, consider that it could be an underlying bigger cause. Because the World Health Organization defines health not as the lack of symptoms. I could have stage 3 cancer right now and not have pain. It doesn't mean I'm healthy. But it means the World Health Organization defines health as an inner peace between physical, mental, and psychological well-being. So don't, I've had patients who've come in and they got in they've been in a car wreck and their car flipped 6 times and they didn't go to the emergency room. They just said, oh, I didn't feel anything. I walked it off. That doesn't mean anything. Years later, they come in and they say, my neck is killing me. I didn't do anything. And I asked them, have you had a car accident before? And the majority of them say, yes, but I didn't feel anything. I said, it doesn't matter if you felt anything there. The damage, the internal damage, 2 tons of steel has crushed your car, made it into dust. Imagine what it does to a 150-pound body. So degeneration will occur if you do not take these problems. So I practice in Alexandria, Virginia, but I also have some cards for Dr. Derek Curran, who's here in the Annapolis area. If anyone ever wants to get checked out, I also have my cards here too. For neurosurgery, Dr. Donald Hope, one of my favorite neurosurgeons I work with, Fairfax, Virginia, has done a fantastic job on my patients. Therefore, that is the end of my presentation, and definitely thank you all for your time.
Specific questions for Dr. Hatam? Are you open for questions, or do you
Yeah,
want to?
absolutely.
Okay.
I'm open.
You talk about degenerative disc problems and stuff like that. What do you do? I mean, I'm at the age where I have it, and it's not going away, and surgery is not going to help.
Well, your neck or lower back?
Neck.
Have you ever done cervical traction?
Yes.
Do you have one at home?
No.
I would recommend what I tell a lot of patients with that issue is go to Amazon, just type in cervical traction pump, so you don't have to carry around a bulky traction unit. Just wrap it around your neck, pump it up, and that'll take pressure off the nerve root and actually relieve your neck and its symptoms from degeneration. Because degeneration is permanent,
right.
But you can you can decelerate its progress.
What else? I mean, that's like You know, I can understand that. but-
Also doing neck exercises, of course. Remember I showed you what the curve of your neck
Right.
looks like. Have you had an x-ray recently? Get an x-ray done and see if your neck looks normal or if it looks opposite, like I showed in some of the images. Sometimes by doing exercises to fix the curve of the neck, you know, simple exercises, taking a towel and going like this, getting that curve back, getting that lordosis restored will decelerate degenerative disc disease.
Right.
So posturally,
That's
yes.
basically what the goal is.
Yeah, absolutely. You got to decelerate. You can't. It will not go away.
Right.
But you know, also remember what I said. Don't
Right.
do this with your phone. That's one of the biggest culprits.
And how does that affect headaches? You know, when you're a choir, you're going to be talking about headaches. How does that affect headaches?
Well, a cervicogenic headache is a headache that starts from the neck.
Right.
Now, if your neck is the culprit, if your neck, for example, should be curved like I showed it earlier, but it's curved the opposite direction, it's going to cause headaches. Because I've had a lot of people who've come in and they didn't know what their headaches were stemming from. They've done all gluten allergy tests and they've had MRIs of the brain. That they couldn't find the culprit of it. But it turned out it was just a cervicogenic headache from bad posture. And after I told them some exercises to do, after many, many months, their headaches actually resolved. But one more story I have regarding headaches and a more serious problem. I had a 27-year-old gentleman earlier this year. He was an airplane mechanic, and he came in and said he was having headaches for 3 weeks. Only thing that would give him relief was Excedrin, but only for like 20 minutes. So he came to me, and I imaged him. I didn't find anything wrong. But last minute, I said, you know what? Why don't you get an MRI of the brain? Took the MRI of the brain. It actually showed he had a pituitary tumor growing. He had no clue, so we actually had to send him for another one with contrast. And it found out that the tumor was so big, it was affecting his hormones, because the pituitary gland is what controls all your hormones. Now, this particular tumor had elevated one of his hormones so much that now he's going to have giganticism. I don't know if you guys remember who Andre the Giant was. He had the same disease. So unfortunately for him, until he removes that tumor, which is definitely a hard thing to do for his age, and because of the location of the brain, he's going to have headaches indefinitely. So another reason why not to ignore symptoms. Majority of headaches are migraines, tension headaches, cervicogenic headaches, but sometimes they could be stemming from a tumor in the brain as well. So if your headache doesn't go away, go see a neurologist, my biggest recommendation. If that comes back clear, then you can start working on posture to fix the problem.
Physical therapy?
I do my own physical therapy in-house,
Okay.
so I do everything myself. I have a couple of times for more, like if it's more of a knee problem or extremity problem, even though I do treat extremities, I do send them to a local physical therapy office if it's something that's just too advanced. That, for example, there are physical therapist offices who just do extremities only, so I work with them for those issues. Yes, sir.
Are there any organizations or books that you would recommend to look further into the topic?
Which topic?
Yeah, that was a lot.
Yeah.
Pain prevention or...
I would recommend going to a website called idealspine.com. It talks about how you can, about how the importance of the curvature of the spine, the posture of the spine to overall health, and what you can do to prevent it. And also several exercises and orthotic blocks you can use to actually restore some of those issues.